So welcome and thank you all for joining us for this most momentous occasion here at our hospital. It is truly a day to celebrate as we mark the opening of MedStar Health's new emergency department and front entrance at MedStar Southern Maryland Hospital Center. Years of careful planning and preparation went into making this day happen, even before we broke ground in September 2019. And as I stand here today, I am proud beyond words that this project, and where's my team, we kept the project on schedule and moving forward despite COVID-19 pandemic. Our hospital's emergency department is a cornerstone of this community and a critically important part of the way we serve the people of this region when they need us the most. Now our patients will benefit from our state-of-the-art emergency department with twice as much treatment room in a streamlined, modern layout. With its final completion later this summer, this project, totaling more than 100,000 square feet, it also features a dedicated area specifically designed for people with behavioral health and substance abuse challenges. There are additional special features that include a 128-slice CAT scan, negative air pressure capacity, significantly augmented because of the pandemic and way beyond code requirements, and a specialized area that we need to treat people with special pathogens that are dangerous to health and all. Many other unique features that you'll see today. But all in all, this facility will truly represent state-of-the-art emergency medicine capabilities. So there is so much to be excited about today, but we could not have gotten to this point without the hard work and dedication of our many partners. So a big, big thank you goes to Callison RTKL. They are our project's architectural and design firm. To my Whiting Turner team, thank you so much. They're the general contractor. CBRE, being the project manager. We are also so grateful to our local utility partners, PEPCO, Washington Suburban Sanitary Commission, and Washington Gas, all of whom work side by side with us to ensure full hospital operations throughout this project, throughout the construction. That is no easy feat. On a personal note, though, I just want to also say thank you to our executive sponsors at MedStar Health, Ken Samet, Joy Drass, Mike Curran, and Susan Nelson. To our other colleagues at MedStar, Ed Robinson, who is our fearless leader in this project, to Sarah Collins, to our own Grant McClure, Lou Mavromatis, Mike Meisel, to our extraordinary clinical leadership who kept us safe, Dr. Chilledum Ahaghotu, Cody Legler, and to absolutely the designers of what you're about to see in reality. Where's Kristen Quaid and Doctors Kevin Reed initially and Drs. Kevin Struggs, our new chairman of the emergency department. Amazing team, and I know I've left others out, all of us supported by many, but just a phenomenal effort. So it was and continues to be a team effort on behalf of our community, most importantly. So now, on to the program. It's my honor to welcome to the podium MedStar Health President and CEO, Ken Samet. Give me a minute.
Well, thank you very much, Chris, and thank you to all of you for being here today. I'm really pleased because today is such an exciting day, and it marks the next important investment by MedStar Health in the healthcare delivery for the residents of Prince George's County, Charles County, and the broader Southern Maryland area. It's personal to me because I've been coming to this campus for over 30 years, and both before it was in MedStar and from day one while it was part of MedStar, what's always happened here is that we had dedicated physicians, nurses, therapists, and all the support personnel to make sure that world-class care was given to patients in need. What's now happening today with this investment is the ability to combine state-of-the-art technology, world-class facilities, with the most incredible clinical talent so that we actually can deliver state-of-the-art care that's not very often found in community hospitals right here, closer to home for those we serve. It's an important part of MedStar's overall strategy. As my team knows, we talk about building a distributed care delivery network. And today that is over 300 sites of care that are spread across the region. And what's really important is that it's not just physical facilities. As special and amazing as this looks, if it doesn't actually have world-class personnel connected to the entirety of the MedStar system, then it doesn't raise the level of care as high as it should be and can be. And I'll give you two terrific examples of that as you think about what's here at MedStar Southern Maryland Hospital Center. Connected on-site to the MedStar Heart and Vascular Institute from MedStar Washington Hospital Center and the MedStar Georgetown Cancer Institute. In both cases, not just a relationship that will take patients there, but bringing those specialists here on a full-time basis to work with this medical team, to take care of patients here with technology and care, completely connected, we call it systemness, into the MedStar system, so that again, you can get the care you need here, and when you need something different, it's not like going searching if you're a patient. You are well cared for. And so again, when I stand here and I think about the healthcare heroes that Chris mentioned, every day before COVID, but sure deep in our hearts during COVID, those healthcare heroes deserve everything we can give them. And you all being here today, your support every day as board members, as philanthropists, as community leaders, as really important political and legislative partners, that's how they know that their work is valued. And so this is so meaningful, and I'm so glad that we're able to share this together. Just a couple of thank yous I want to do, and then we'll continue to move the program. I do want to thank so many, and you'll hear from a number of them, but projects like this require lots of support over many years. And so our thanks to the governor, to our friend Steny Hoyer, who was here early this morning with us, to all of the legislators across Maryland, again, and our partners and friends in Prince George's County and Charles County. You're going to hear from many of them this morning. I also want to do a special thank you to John Rollins, the MedStar Southern Maryland Hospital Center Board Chairman, and his wife Ann for making a leadership gift in support of this project. And I want to also thank Antonio Pogue, I know he's here, and his wife Sharice. Again, an important leadership gift from the board and all of the MedStar Southern Maryland Hospital board members who were supportive, members of the medical staff, and many of you members of the community. Again, your philanthropy helps us make a difference. And finally, I just want to acknowledge with gratitude the hospital's founder, the late Dr. Caramonte. Dr. Caramonte, Dr. C, as we all knew him, he had a vision almost 50 years ago to bring advanced medical care and high-quality clinicians to this location. And as I said, I had the pleasure of knowing Dr. C for many, many years, and I am certain that he's right now looking down and is really pleased and proud of what's happening with the original vision that he had. And from a MedStar standpoint, we're very pleased, as I said, that we can build on that vision, and hopefully one day we'll leave this even stronger and better for all those that come after us. So thank you very much. Very excited to be here and really glad that you all are here to support us. Thank you.
And now, my partner in crime, Dr. Chilledum Ahaghotu, who is our Vice President for Medical Affairs here at the hospital. Chili.
Thank you, Chris. I'm delighted to be here today and very thankful that this project has come to fruition. It represents a major step forward in the evolution of Southern Maryland Hospital Center's strategic commitment to the region. I'm proud to be part of an organization that rose to the challenge of continuing to provide safe and effective emergency care throughout the major reconstruction of our emergency room environment. Delivering high-quality patient care during this construction and renovation involved a lot of operational complexity, added stress and strain to our care teams, administrators, and everyone involved in supporting our emergency medicine program. Throughout the project, we continue to successfully manage high volume of complex, high acuity patients with the additional overlay of, yes, a once-in-a-lifetime global pandemic. And during this time, we were actually able to improve the efficiency of our services, reducing waiting times, improving patient flow, and actually improving patient experience in our emergency room environment. I am in total awe of our healthcare professionals and proud to be part of the team supporting them. One of the primary goals of the work that we do here is to promote health and well-being for our community. And delivering high-quality, efficient emergency care is a very important part of that goal. For example, our state-of-the-art special pathogens facilities that now will be available will serve as a resource for the entire Southern Maryland region in the event of an outbreak involving a high-risk contagion such as Ebola. Also, mental health challenges and substance abuse are more prevalent than ever, as we all know, and our specialized behavioral health unit in the new ER will help us to support patients during their moment of crisis with a safe and caring space. These new capabilities tie into our recent HSCRC funded project in partnership with Totally Linking Care in Maryland and the Prince George's County Health Department to expand our behavioral health crisis capacity in the county. Finally, I'd like to thank MedStar Health's leadership, led by Mr. Ken Samet, for the vision and commitment to our hospital and the Southern Maryland community. I'd also like to acknowledge our community partners, many of whom are in the room today. Thank you for the support that you provided for us during these challenging times. I look forward to the positive impact that this project will have as we continue to expand and enhance our services. Thank you very much.
It is now my honor to introduce from the United States House of Representatives, the Majority Leader, and our Congressman, Steny Hoyer. Congressman Hoyer has been an advocate for our work and for this project from the beginning, and we're so grateful that he was able to be here today with us. Congressman?
Thank you so very much. I am so pleased to be here with Christine Ray, my dear friend and the president of the Southern Maryland Hospitals, and Ken Samet, one of the great leaders for healthcare in America, and the president and chief executive officer of MedStar Health. And also to be here with my friend Steve Proctor, who has been such a force in Southern Maryland for good. Steve, thank you very much. I know that Senator Jackson will be here, who represents this district, Charles County Commission President Reuben Collins, Prince George's County Chairman Calvin Hawkins, Council Member Sidney Harrison, Ken Samet, of course, is here, and I've mentioned, and Christine Ray. This is an exciting day for Southern Maryland. This is an exciting day for the people of Southern Maryland and, frankly, for Prince George's County, who will be benefited by the extraordinary progress that has been made here at Southern Maryland Hospital. So I want to wish everybody a very successful day as we celebrate this new facility. Now, it's not new in one sense, but it's new in another sense. I want to thank you for continuing to affirm MedStar's commitment to delivering quality health care, Ken, to communities here in Prince George's County, Charles County, St. Mary's County, and across Southern Maryland. The people of Maryland's 5th Congressional District benefit greatly from all the work that you and your team have put in over the years to ensure that our communities can access the high level of health care and treatment options that this hospital and other MedStar facilities make possible locally and regionally. I want to express my gratitude to all of the frontline healthcare workers here at the hospital. God bless them as they bless our community. They have been at the vanguard of Maryland's fight against COVID-19 and are essential in the effort to get all adult Marylanders vaccinated. Thank you for that effort. I urge everyone who is here and who is watching remotely, when it's your turn, please get vaccinated. That's our ticket to reopening safely and returning to normal. Wear your mask, or as the governor says, wear your damn mask. Wash your hands, and yes, keep your distance. CDC has said we can be a little closer, but keep your distance. I know that the men and women who work here at this hospital are very eager to see their fellow Marylanders get vaccinated. It's good for you, and it is good for them, and it is good for us. In my office, I have a bust of John F. Kennedy. He is wearing a mask. And I point to that and said, ask not what your country can do for you, but what you can do for your country. This new emergency department, how exciting. 50% more treatment rooms, a new waiting area for patients, which is going to be so appreciated, I know, and their loved ones. A dedicated space for behavioral health patients, and yes, much more. My hope is that this opening is one of the first steps, but certainly not among the last, that we take to address the healthcare disparities that our minority communities continue to face. COVID-19 has shown us starkly, dramatically, and sadly about the disparity that exists between those of us who are majority and those of us who are minority communities, and particularly people of color. This emergency department is also COVID-19 ready, with special upgrades implemented over the past year to meet new demands. And the newly expanded front entrance to the hospital will provide a very warm and comforting welcome to those who come here seeking care and healing. It is a bright, modern, and includes a new gift shop and cafe that I understand, Christine, is going to be open 24 hours a day. These improvements will ensure that the MedStar Southern Maryland Hospital Center can continue to provide high-quality care to residents of the 5th Congressional District. And I am proud to join Ken Sabat, Christine, and County Executive also Brooks, Chairman Hawkins, Councilmember Harrison, County Commissioner President Collins, and Senator Jackson. They're all here as a dramatic demonstration of how important this improvement is. So along with our local officials, I'm here to help cut this ribbon today and inaugurate an exciting new phase in the hospital's growth. Healthcare is of great attention to those of us in Congress, to those of us in this state. And we talk about it, and we pass bills about it, and we appropriate money. But it is the people who work here in this hospital who make it real. The administrators, the doctors, the nurses, all the support personnel, the administrative personnel. What a difference they make for healthcare in our community. So I am so pleased to join the people of MedStar, the leadership, and all the personnel who work here in celebrating this dramatic and important step forward in the facilities that are available to we in Southern Maryland to meet emergencies, to meet intermediate care, and yes, even long-term care. Thank you, Ken Samet. Thank you, Christine Ray. Thank you, Southern Maryland MedStar. God bless. Okay.
Next, another amazing, supportive person, friend, and so proud that he is now our Senator, Michael Jackson.
I'm going to be pretty brief because I'm actually here often. Unfortunately, during the pandemic, I haven't been here as often as I like. I am so proud of MedStar Health. This is very personal to me as well. This has been the hospital for my family. We are rooted in farm family from Southern Maryland. And this hospital has served, the Jackson family, which is a pretty large family, for quite a long time. What's most important to me is the fact that you all have become more than just a medical health provider. You become a community partner. Mutually beneficial partnerships is what it's all about. What you see here are partners that I've relied upon for years, and what I see here are partners that I relied upon when we have community concerns from the health perspective. Behavioral health, you guys have knocked it out of the park once again, being on the foreground of what we all have experienced, but have taken that courageous leap to make sure that we address. I'm so proud of that commitment on your part. The expansion of this emergency room, because guess what? Once you open your doors and you became that community partner, folks come. So you began to get more folks. It's not the same number of folks. You began to get more folks because as they've understood that you're reaching out to the community to serve their needs, not your needs, their needs, you have to be prepared for that. I am happy to be a small part of what you need to get accomplished here. We will remain committed to your need. You always have a partner, from the state level, particularly from my office, and the fact that I was just recently appointed the senator to replace, I shouldn't say replace, to step into the position of Senate President Emeritus Mike Miller, who mentored me for years, even when I didn't know I was being mentored. But one of the things that he always talked about was honoring the service that you have been, have found yourself in, and understanding that this is greater than any of us, and the fact that tomorrow's needs is something that you have to make sure you have a partnership with the folks who can actually provide it. We can only do a small part from the legislature, but I rely upon you to ensure that we know what you need, and you have my commitment as you continue to go forward and to serve not only Prince George's and Charles County in Southern Maryland, but on the personal note, you serve my family and my grandbabies. So thank you all very much for having me here today. We're like a little over a week left in the session, so when I have to cut out in a little bit, you'll know why. But I'm proud to be one of your partners. Thank you.
I'm pleased to bring up our next speaker, Prince George's County Council Chairman Calvin Hawkins, who has been a true partner throughout this process and throughout the pandemic. He never left us alone. He took good care of us, and so we're so glad you're here.
My chief of staff is here, and Ashley, those great remarks you prepared for me, I will leave in my pocket. I want to say to John Rollins and his family, Anthony Ho and your family, thank you for your contributions. And to all the other donors who have made this day possible. Trey, when your father, Steve Proctor of GS Proctor and Associates, told me to come by to see what was happening over here in South County, Christine Ray, and we had the, the announcement when then Senator Jackson, your predecessor, Senator Mike Miller, was there. All the speakers stood, but because of his wanting health, the senator could not stand, Mr. Solomon, and he sat there with Christian Ray and he talked about what all of this means to not just Prince George's County. Chair Collins, Mr. President Collins, Rubin, he talked about what it meant to Charles County and Calvert County. And Southern Maryland Hospital under MedStar has been the heartbeat in Prince George's County for the southern area. So I'm grateful to be here, Christine, Dr. Chille, the one we call the community's champ. We are grateful to the work you all are doing. I don't want to use my prepared remarks because, like Mike, I want to just speak about Christine and Dr. Chille when my mother was here in the last stage of stomach cancer. My family was so distressed, so disappointed because we believed death was at the door. But your professional staff gave us hope and inspiration based on their medical preparation for my mother. I would run into Dr. Rubenstein and didn't even know he was my mother's doctor, but they were always positive and inspiring to every patient and their family members and loved ones that come to this facility. So to have this moment, to have this ribbon cutting for this very important resource to help the great individuals who work here at Southern Maryland MedStar Hospital is outstanding. And I just want to say on behalf of my colleagues who will speak after me, Prince George's County Council stand with MedStar today because the work you've done has brought us to this moment. And we shall forever, forever be the partners that you desire in government officials. And I'm just grateful to be among my colleagues and have this very important historic moment to be with you. Thank you very much.
And next on our guest speaker list is another amazing partner who has never left us alone throughout this whole difficult year. He is our own District 9 Councilman, Sidney Harrison.
It is a pleasure to be here. I just want to say thank you for everyone who is attending this most important occasion. Let me just start off by saying that, each and every day, we got to really show gratitude to our healthcare heroes. More than ever, they have been serving our community each and every day to provide the appropriate healthcare to our residents here in southern Prince George's County in southern Maryland. And when the pandemic hit, we saw how important we needed them, how important they were, and that they did matter. And when you look at the expansion of the emergency room here at Southern Maryland MedStar Hospital, you understand the importance of communication, collaboration, and consistency. No one can do it alone. And when I'm thinking about over the 45,000 people this emergency room serves each and every year, you understand why this day had to happen. I just want to thank Dr. Chille for your community involvement, your community engagement. The MedStar family has been deeply rooted in southern Prince George's County and southern Maryland. And when you have communication, you can tackle some of the challenges that you face as a community. So when we look at the vaccine, these vaccine tents right over here, and you look at over the 900,000 people that live here in Prince George's County, the importance of making sure that everyone gets vaccinated, Dr. Chille has been at the forefront communicating with each of us, everyone that you see here, to make sure that our residents here in Prince George's County get vaccinated. And that's because of communication. So In closing, I would like to say thank you to President Ray for your heartfelt contribution and care to our community to improve the healthcare landscape here at Southern Maryland MedStar Hospital. And when I arrived this morning, Miss Ray met me right there, and she wanted to talk to me about the expansion of behavioral health services here at MedStar Hospital. And I'm sure that people are coming to the emergency room to get care for behavioral health. It's expanding each and every day. And we cannot be afraid to talk about it, because all of us know someone that is experiencing some challenges within that. And so we thank you for your innovation. We thank you for your leadership. And we thank you for your care and love. We truly appreciate you. The District 9 office is truly committed to working with you and your leadership team here at MedStar Southern Maryland Hospital. Thank you.
Thank you so much. So now I'd like to welcome the President of the Board of Charles County Commissioners, Reuben Collins, who is another staunch ally and advocate of the need for this expanded emergency services across Southern Maryland. So thank you, Reuben, for being here.
Good morning, everyone. I know the most logical question is, okay, well, why is this guy from Charles County here? Well, I can tell you, this hospital has established itself as a regional hospital. MedStar has expanded in Charles County as well. We're proud to also be a partner with the hospital in this hospital center. A solid ER division is where the rubber hits the road. It's the direct connection to our community. This facility is providing additional resources for our residents in the Southern Maryland region to be provided important healthcare services. One of the key components of this that really impressed me was the idea of providing expanded behavioral health services for many of our residents. Like Prince George's County and other jurisdictions throughout our state, we've recognized the importance of providing these additional services to our residents. And so it's the key component into anything that we look at as we proceed for the future. We will continue to be strong supporters because we recognize how important this hospital is to the Southern Maryland region and to Charles County. And just as a quick aside, and I've mentioned to a couple of people this morning, this was my family's ER, even though we lived in Waldorf. When my children were very young, and I know many of you can appreciate, those 2 or 3 o'clock in the morning calls where, your children, something was wrong, but this was the go-to site for us. And it's always been a professional, top-notch hospital. And I want to thank all of you for giving me the opportunity to speak on behalf of Charles County government. We are partners with Prince George's County. We are regional partners. We work directly on many issues, and healthcare services is clearly one of the most important. So thank you all, and God bless you.
I know. So before we do the official ribbon cuttings, where we have some other of our representatives here today, we'll include them in our ribbon cutting. But before we do the ribbon cutting, we wanted to just pause and take 1 minute amongst some of the other noises of the day. but we wanted to have a quiet moment. And so I'm really pleased to have the opportunity to ask Reverend Charles McNeill Jr., who's the president of the National Capital Baptist Convention and the county executive's faith community liaison, to lead us in a blessing in honor of our new emergency department and front entrance. Pastor McNeill.
The thing that we share the most, what we have in common, from whoever we worship and whoever we call our Creator, is love. Love is what binds us. Love is what holds us together. Love is what causes us to serve and to be able to acknowledge one another. So as we come today, just to say a brief prayer. Today we come to dedicate, celebrate, and give thanks for the human efforts that have inspired and encouraged each of us. In serving humanity, we are reflecting our Creator's attributes. Today we stand in unison before our Creator with an attitude of service and support to aid those who are in need and require assistance. We come before you today to honor you as our Creator and our healer. We gather today to thank you for this beautiful new medical facility. You are our Creator and our sustainer. You are our light and our fortress. You are our wisdom and our strength. We ask for your guiding hand to lead us in dedicating a facility that we heal and restore. May we approach our task with wisdom, and may we approach those we care for and serve with empathy and respect. May our conduct create an environment of cooperation and kindness. We thank you for helping us to accomplish our task this day. We ask that you put your hand of blessing on this building and on all the medical equipment and all the men and women who will be working here to bring healing to the sick and injured through your benevolence and grace. We pray that this place would not only be a place of healing, but a place of gentleness, kindness, and compassion. We ask these things of you, our Creator. Amen.